Ken Howard, a licensed psychotherapist in West Hollywood, California, in private practice. And I see people in my office, or I also talk to them on the phone, or we work via Skype. It depends on where you're living. But my specialty for a long time has been about the idea of self-empowerment. And that's the name of my book, Self-Empowerment, Have the Life You Want. And I started out, and I still do, quite a bit of work with gay men, and even among gay men, those who are affected by HIV. It was 1990, and I was 26 years old, and I had been in California for a number of years since then. I'd gone to college here at UCLA, and my best friend that I grew up with in Virginia, outside of Washington, D.C., who is my age, had tested positive. And we were surprised that someone as young as him tested positive. And so I thought, well, oh boy, I better get tested too. And so I got tested too, and I was positive too. And we were surprised because we were thinking, oh, that was something that was happening to older guys in another part of town. And it made us realize how extensive the epidemic had become. And it was difficult because we were on the younger end, and we had never been in a relationship, and we hadn't exposed each other, which meant that we had each been exposed in some other way through our travels, him in Washington and New York and me in LA. And it took some getting used to say the least, because everyone that I knew who was also positive was much older. And now we know that HIV affects people very young, you know, sometimes into their teens, and a large group of young men are at risk. But back then in 1990, it was more rare. The first support group that I went to, I remember thinking, oh, all these guys here are much older. And it made me realize the importance of support services for younger guys, because there weren't as many. But it was an eye-opener about, at that time, how extensive the epidemic had become. And that was when I really started to become aware that I wanted to help others. I felt like we were drafted into a war that we never volunteered for. And that's when I started doing volunteer work. I was a phone buddy, a phone counselor at AIDS Project Los Angeles, which was relatively new at that time. And I remember thinking at that time, my grandfather, that I was very close to, was alive, and he was 91. And I worried about whether or not I would outlive my 91-year-old grandfather. But that was the thinking at the time. That was a lot of uncertainty. A lot of people were dying, a lot of people were getting sick, but a lot of people were just HIV positive. If you know, it sounds funny to say, but there was a lot of uncertainty. And my best friend that we had kind of tested around the same time, his initial tests, and there wasn't viral load testing then, there was only T-cell testing or CD4 testing then. His count was very, very low, and so his stakes were much higher in terms of risk to his health. My count was very, very high. And I remember that was a source of conflict for us, because we had both tested positive at the same time, but my count was so much higher, which meant that I had time before I had to start medication at that time. So there were a lot of things to adjust to, and I remember the day, November 3rd, 1990, and since then in my work with people who are newly diagnosed, people always tend to remember the day. It's just a funny thing, but you know, I can't remember what I had for breakfast yesterday morning, but I can remember that date. I think the first step is don't panic. I get a lot of emails or phone calls, and people are understandably upset. But HIV is a chronic disease, and it requires a chronic response. It's not like cutting yourself open and rushing to the emergency room to get stitches. There's really not a huge rush. But it's an important thing to get access. I think to get access to emotional support like therapy or a support group, to get access to an HIV specialist physician. You know, research has shown that people with HIV do better when they have access to a specialist physician, and no matter where you are in the country, so insist on that. And there's that word access. I always say the #1 word in health challenges is access. Access to expert medical help, access to medication, access to the laboratory tests that you need. And I think also the spiritual and the emotional components. You know, there's taking care of yourself medically, loving the self enough to take care of yourself medically, especially with taking medication when you need it, and the right medications, which takes a discussion with your doctor. But then there's the emotional side. There's forgiving yourself for becoming exposed. A lot of people have a lot of guilt or shame or confusion around that, and we have to forgive ourselves first, because that opens us up to taking care of our best self. And also forgiving anyone who might have exposed us through drug interaction or sexual interaction. We have to forgive them too, or else we carry that burden. And getting through life, we can't expect to get through life without some kind of a mistake. People say, oh, if only I hadn't had sex with this person, or unprotected sex, or done these drugs, or shared these needles, or whatever. What middle-aged people know, now that I'm middle-aged, that young people don't, is that you can't get through life without making some kind of mistakes. We're going to hurt people by accident, and we just have to take responsibility and go on. So we have to forgive ourselves, we have to forgive others. And I think to be open to loving the self. I love myself, therefore I take care of my medical health. I love myself, therefore I take care of my emotional health. Because HIV is not just a medical disease, it's also got an emotional component and a spiritual component. And that's been my thing for over 20 years as an HIV mental health expert, is to understand the spiritual and the emotional and take care of those just as you would take care of your physical health by taking medication.